So welcome to MLT online classes. In this lecture I'm going to discuss about infertility. So what is infertility? Infertility means unable to bear a child is called as infertility. So unable to have pregnancy after 1 year of unprotected sex. Even after having 1 year unprotected sex, if the female is unable to get a baby means that indicates it's an infertility. That indicates that the woman have some fertility problems. So these conditions are called infertility. So whenever we are thinking about infertility, we used to feel like there is a problem in the women's, right? So not only in women's, there might be problems in the males also. Males also responsible for infertility. Maybe males have problems like his sperms are not in a proper way, his sperm count is less, or sperms are in abnormal morphology, or there are some disorders in the testes of the males, or male has some metabolic problems where he is unable to produce a sufficient sperms. So male also contribute to infertility in the infertility. Okay, so let me write a brief definition for infertility. So infertility means it is defined as not being able to get pregnant after 1 year of unprotected sex. After 1 year of unprotected sex. So that results after 1 year unprotected sex, if the woman is unable to get a pregnancy means that indicates infertility. So these infertility are broadly classified into two types. Infertility problems in the males and infertility in the females. So what are the problems in the males can cause infertility and what are the problems in the females will cause infertility? Let us see. Okay. So first is infertility in the males. So the first one is oligozoospermia. Oligozoospermia means decreased sperm count. Decreased sperm count less than 20 million per ml of semen is called oligozoospermia. Obviously, you need at least 60 to 120 million sperms to get a baby in a male sperm count. Okay, so whenever male sperm count reduces lower than 20 million, there is a very less chance of getting fertility due to low sperm count. So one is low sperm count. Decreased sperm count is called as oligozoospermia. Then second one is abnormal sperm morphology. Sometimes this male will have normal count, like he will have 120 million sperms, but his sperm morphology is very abnormal. Say for example, he may have double-headed sperms, double-tailed sperms, or a immature sperms or immotile sperms. So all these abnormal sperms can also contribute to infertility. So that is called as abnormal sperm morphology. There is one technical term to say abnormal sperm morphology. It is called teratozoospermia. Teratozoospermia. So teratozoospermia means abnormal sperm morphology. So teratozoospermia also can result in infertility problems. Then we already know that the sperms are produced by testes, right? And testis has one duct. What is this? Epididymis. And this epididymis is connected to the prostate gland and urethra by a duct. What is this duct called as? Vasa deferens, right? Vas deferens. If there is any obstruction in this vas deferens, sperms cannot move to the urethra and they will cannot fertilize the woman. So obstruction in the vasa deferens also results in infertility conditions. Other than this, we have other conditions like cryptorchidism. So cryptorchidism means the testes won't descend to the scrotum sac. So testes will be in the abdomen of the growing baby or the person. So that condition is called cryptorchidism, and that results in lack of sperm production. Due to lack of sperm, they can't reproduce. So that is one condition. Then the second one is trauma to the testes. If the testis has any mechanical damage, any bleeding disorders, trauma, that obviously results in decreased sperm count. That results in infertility. Then mumps. Mumps is a viral infection which will attack the testis. So it is a STD It will show affinity towards the testis, and this virus will destroy all the sperms. That results in infertility condition due to low sperm count. Then alcoholism. So increased alcohol consumption can also result in infertility. Take care, boys. Don't drink alcohol. Fine. Then last and finally is genetic disorders. So multiple genetic disorders can cause infertility conditions. Say for example, there is one condition called Turner syndrome, then Klinefelter syndrome. So there are some genetic disorders where the male won't have a 46 chromosomes, rather than he will have euploidic condition where he will have abnormal aneuploidic condition where he have abnormal chromosomes within his sperms, that results in infertility conditions. Okay, so these are the conditions in the males that contribute to infertility. Then let us see the conditions in females which contribute to infertility. So the first one is, so I am going to erase this part of the board. So as we already know, this is the uterus and this is fallopian tube. Fallopian tube has fimbria, and this is ovary suspended by a ovarian ligament. So this is vagina. Fine. Okay. So if there is any obstructions in the ovaries, if there is any problems in the ovaries, female cannot release ovum. Without ovum, she will have infertility conditions. So the first one is ovarian abnormalities. One best example is PCOS, PCOD or PCOS. Polycystic ovarian disease or polycystic ovarian syndrome is a condition where the female will develop tiny water sacs within the ovary, and that results in a precancerous condition and she can't bear a baby. So PCOD is one of the ovarian abnormality where a woman will become infertile. Then second one is abnormalities in the uterus. So some women may have small uterus, or the uterus is not properly developed, or there are some damages to the uterus, or there are some abnormal structures within the uterus, like say for example tumors or cancers, and these kind of uterine abnormalities can also result in infertility in women. So uterine abnormalities, and first one is ovarian abnormalities, second one is uterine abnormalities, then third one is absence of ovulation. Ovulation means release of ovum from the ovary. Maybe female is suffering with deficiency of hormones, progesterone and estrogen. Maybe she has some hormonal imbalance, and due to lack of these hormones, ovulation haven't occurred. So lack of ovulation can also result in infertility in women. Okay. So other than this, other conditions such as diabetic mellitus, renal disorders, liver disorders and hypothalamic disorders can result in infertility in women. If you want further information, you can go through my material. So that's it. Have a good day, students. See you in the next lecture.